In your blood collection kit you will find sterile wipes, 3 lancets, 2 sample collection tubes, 2 plasters and 2 protective cases. Warm up your hands to help with your blood flow, and then take a sterilising wipe and use it to sterilise your finger of choice. Take a lancet and twist and pull the top off, and then to prick your finger, lay your hand on a flat surface, press the lancet firmly into the middle or side of your fingertip to make a small cut. Keeping your arm straight, massage down your finger, allowing drops of blood to fall into the tube. If your blood stops flowing, prick another finger. Once you have filled to the 600 line, push the lid down firmly so it clicks, and then clean your finger with a tissue and apply a plaster. Put the sample tube inside the protective plastic case and store in the fridge until you are ready to post back all of your samples in the plastic envelope.